So the CANOVA trial is a Phase III clinical trial investigating the use of Venetoclax and Dexamethasone versus Pomalidomide and Dexamethasone for patients with multiple myeloma who are refractory to lenalidomide. And this is a study that actually kicked off in 2018 and is only reporting its interim analysis now. And the reason why it's taken quite a long time to enroll is that we've been specifically looking for the T1114 biomarker subgroup of patients, which only encompasses 10 to 15% of patients, and hence it takes a little while to enroll these patients. The results were presented by Maravi Mateos and essentially demonstrate an improvement in progression-free survival for Venetoclax and Dex compared to Pomalidomide and Dex. And whilst numerically there is a substantial improvement in progression-free survival, statistically the primary endpoint was not met. And when we look to understand why the primary endpoint was not met, what we find in the flow of the treatment pathway is that more patients in the pomalidomide and dexamethasone arm were withdrawn from the clinical trial without progression. Now, we don't have full data for that, but what we do know is that some clinicians may have been uncomfortable with patients being on the control arm and have withdrawn them earlier compared to the progression. And specifically, we find a disparity between the clinician-reported progression events and the independent review committee determined progression events. And that accounts for some of the disparity that we're seeing. So if we do an adjusted progression-free survival analysis where we take into consideration when patients are starting next treatment, we then find a statistically significant improvement in progression-free survival for Venetoclax versus dexamethasone. The overall survival data is still immature, but is trending towards an improvement with Venetoclax and dexamethasone. And if we look at MRD negativity rates, there is a improvement with Venetoclax and dexamethasone. So I think in terms of efficacy, the wealth of data that we have on the CANOVA is favouring Venetoclax and Dex for patients with 1114. Now, from a toxicity profile, what we do see is an increased incidence of infections with Venetoclax and Dex compared to PomDex, and there were 7 deaths with VenDex, and no deaths were observed with PomDex associated with infections. And so again, I think we need to relook look at prophylaxis and intravenous immunoglobulin to try and limit any significant and fatal infectious events.